Hi, I'm Virginia from Right Clinic, and here with me today is Eleanor Stanley, who has a health communications consultancy called Articulate. Thank you so much for being here today, Eleanor.
Oh, thanks, Virginia. It's lovely to be here with you.
Thank you. I really enjoy following your posts on LinkedIn, and so it's so nice to have an expert here that's been a freelance health communications consultant for so many years and worked with so many clients. And I'm sure our audience is really going to enjoy this episode and learn a lot from you. So let's start with, what do you do?
So, in my consultancy, I do writing, filming, editing, but probably the most important thing I do is talking with clients to really thrash out together exactly what they're trying to convey, who it's for, what they want to happen as a result of people consuming it, and also talking to case study people who might be patients or healthcare professionals or senior leaders, to help convey their story in their words in the way that they feel really happy about.
Amazing. So how did you get into that?
Well, I started doing editorial work soon after university. I did anthropology, which is surprisingly useful actually in health communications, as it turns out. Took me a long time to get there though. So I worked in house in publishing. Um, then I decided I wanted to work in health and social change. So I started doing freelancing in various different charities. And then I ended up moving to the King's Fund, which is health policy, health think tank. And I worked in house there for about 10 years. And that's where I really fell in love with health and understood, as a creative person and as a compassionate person, hopefully, there's just so much richness there to work with. It's just really satisfying for me. And also, there's a real need for clear and engaging health communications.
I love that. I love that you started in anthropology and then went to the King's Fund and just enjoyed it so much. You were there for 10 years and then you kind of branched off into your own health communications consultancy. So what was kind of the pivotal moment? I have difficulty with that word. What was the pivotal moment for you to decide, okay, I'm ready. I want to go and explore things on my own?
Well, I was already doing, I don't know if I should, I don't know if we need to redo this bit, Virginia. I don't know, but I'll try and start from it. So at the King's Fund, I was there on a freelance basis, and I was already doing some work with other organisations. But most of my time I was there. Um, I think what really inspired me to move in the direction that I am now was, funnily enough, working on something called the Poppy Guide, which was a guide to patient information, which was written by the founder of the Patient Information Forum, PIF. And as I worked on this, I thought, this is really great. This is really thinking about how to communicate to different people. And then over time, I had the opportunity to work on things like the experience-based co-design toolkit, which involved showing films of patients, feeding back on quality improvement things. And I just started to see that there were so many different directions where it was really important to understand the needs of the consumer, the person who's consuming services, but also who's consuming information. And I felt that I could really add value to that.
I love that. And so what kind of media do you produce and what kind of clients tend to ask you for that type of media?
I guess it's not so much about specific outputs. I mean, the media, the kinds of things that I help work on range from toolkits to films to reports to web copy, blogs, case studies. I mean, you name it, like any of it. And I suppose the key thing is to really understand what the challenge is, and then I'll work with them to think, or how could, who is the audience? What do we want them to do as a result of this? Why are we producing it in the first place? And then what's most effective to reach them? And that's been sometimes complicated for me because I do work on film as well as copy. And that's sometimes a bit confusing for clients because it's just easier if you're one thing. She's a
Yeah.
copywriter, she's a production company, but actually for me it's what these are just techniques to get the message out there. What really sits beneath the whole thing is storytelling, and kind of understanding the message and the strategic objectives. And then it's just like the difference between using a pencil or a biro or a typewriter. They're just different vehicles for sharing the message.
That's really interesting, and it's quite interesting that you have such a dynamic and versatile collection of clients and things that you create for them, and you are always trying to find the best way to deliver a specific message, and then also finding out if that message is something that their audience is going to engage with. So when it comes to co-production and co-design, what are some of the ways that you find the people that they are trying to reach to make sure that what you're going to create is going to have impact?
Well, I'm very lucky that I work with health organizations who have got those links themselves. So usually I'll work with organizations to talk about who might be the right kind of people that we can work with. Um, I do a lot of semi-structured interviews with people, ideally before a project starts, just to kind of really feel my way into what their experience is like. I'm thinking here about patients, but it's also true with healthcare staff. Just chatting things through. You don't know what you don't know, and it's often through an unstructured conversation like that these amazing nuggets come out that will either make a brilliant quote or that are really important things that perhaps the organization hadn't realized really needs to be included in the content.
Yeah, and I think it's so nice that you've highlighted that they might have said something really important or a really engaging quote that encapsulates what you're trying to communicate. And so probably a little bit of a segue um, into how do you think AI will affect that kind of production of content, because AI can only create so much, but you really need the real patient experience, the real world evidence to kind of integrate that. And I think for health communications and health content in general, it's so important to have that personal patient kind of aura around the content that you create so that they can connect with it. So, what are your thoughts on AI, and do you use AI? Are you thinking about using AI?
Yeah, so I use it sometimes. I think the key thing with AI, as far as I can understand so far, is that it's what it can't replicate is individual lived experience, and I think that is also what a lot of other people can't replicate. There isn't enough out there about what it's actually like to live with a long-term condition, and even how managing your medication affects everything in your daily life. Having to go to the chemist 5 times a week, sort through your medicines, remember what to take. That's just one tiny example of what it's like to live with a condition. And I find often the really valuable bits in health communication are those tiny little details that you wouldn't think to ask about, that somebody will just convey. Or perhaps things like I've interviewed people who've talked about feeling very jealous of other people who don't have their particular situation, or these are things that aren't often talked about and that might just flow out in normal conversation. Well, you're not going to get things like that from AI. AI is brilliant to kind of get you going. That's what I find. I mean, we all have difficulties with facing a blank page sometimes, or with AI, you never need to. But probably you're going to be rewriting, 98% of what's there. But if you can kind of use it as a productivity tool, it's great. And I will say, actually, that, AI does have some skills that a lot of health communicators or people working in that kind of sphere don't have, which is it has seemed to learn that you need to have perhaps put a bit of reassurance in there, or like, if you're giving some advice about something, end with a little bit of a kind of a sort of hopeful uptick, instead, because some health communicators are very, here are the facts.
Yeah.
And I think that really can be very traumatic, actually, for people with some conditions to be consuming that kind of content. So that's interesting that AI has got that down, more than, I suppose, people are very focused on just the kind of medical model and not thinking about how somebody's going to be consuming this information. That's very real potential harm.
Yeah, I agree. I think sometimes you can come across as quite direct and unempathetic, which you want to avoid because the person who is reading your information might be the person who is not well themselves, or it might be a relative of that person who is just looking for help because maybe the person who's unwell is unable to look for that information themselves, or they don't necessarily understand it because they have English as a second language, or they're just not used to the healthcare system, or the way that we communicate. And you touched on a really important point there, and I think it's so interesting that AI has picked that up, or in the version of AIs that you have seen or used. And so that is very insightful. Thank you for sharing that. I also wanted to ask, what would you advise people who want to do what you do and they like the variety of projects that you take on? So we were having a conversation earlier before we started recording where you said, you kind of peaked at 14 projects and now you are kind of tying up the last two so you can have a bit of a wind down for the end of the year, which is a great way to manage your consultancy, because you can't be working at 110% for such a long time. So what would you advise people who are looking for that kind of variety and doing what you're doing?
I guess I think the most important thing for me is to have some experience side by side with other people. I don't think you can beat being in a team where you've got press people, marketing, events, all these people, policy, whatever, all these people around you, because you're you're picking stuff up from all of those different disciplines, and you can see what you're doing in the wider context of an organization. And I was really lucky to have that at the King's Fund, and to kind of see where I fitted. There's I mean, also, I would say it's really important to know your individual trade, so to get some proper training. And I mean, if you're going to be an editor, probably the Chartered Institute for Editors and Proofreaders, just to really, so you've got that kind of confidence, and that when you're making recommendations, you know why you're saying it. You've got kind of evidence to back it up. It's reassuring for your clients, reassuring for yourself, and also it means you'll be doing a good job. I think there is a risk at the moment where there are just lots and lots of little courses out there, and they're brilliant to help you hone in on, a few particular specific tasks, but you need a you need a really good solid grounding, I think. And then once you've got that, you can branch out and look at the specifics of all of these. So, having done all of my sort of writing and editing and health and all of that, then I went off and did a course in video creation. And that's great. I'm never going to be a technical, I'm never going to be a camera woman, but I know how it works. And because I had that earlier understanding, it kind of sat on top of that.
Yeah, and I think also when you go and learn something, just to learn how it works, it helps when you want to communicate with the person who's actually doing that thing. So I definitely find when I work with a designer, I know what they mean when they say hex code or something like that. They actually mean the very particular color that they have to use on all of the designs, and it makes those conversations easier. And at the end of the day, it is a collaboration because you are not going to be able to do everything most of the time. And yeah, and I guess on that note, do you outsource in your consultancy to help, build a team around you in order to manage all these projects? Because it sounds overwhelming when you say how many you do.
Mm.
And what is the kind of, how long does a typical project last?
A lot of my projects last a number of months. I try, if I can, to get involved before if it's something that someone else is writing, before they start to write, so
Mm,
that I can help think through how it's going to be structured and all of these things, because it's a lot easier to have an influence at that early stage than to come in at the end. And quite often I'm pulled in to troubleshoot, and
mm,
where you've got something where there's been mission creep and people have slightly lost track of objectives, or there's been all sorts of people feeding in really late in the process that kind of completely changes the brief. And so the earlier on the better. And so then yeah, so with a project like that, there'll be stages where I'm involved maybe for a couple of weeks quite intensively, and then it'll be with the authors, or it'll be with an internal team to be thinking about something, or with a designer, and then it'll come back to me. And what I've been really working on this year has been understanding where you've got a number of parallel projects, um, and often those deadlines are moving. Yeah, how to make them all tally so that the capacity works through. And I have a couple of people who work with me, um, you know, that can kind of help with that, with kind of particular tasks of the process that I feel I can really clearly, brief and outsource, and then bring back and quality control at my end. Yeah.
yeah, I think that's so important that if you do ever outsource anything for any number of projects, that you are looking over what they produce and that it meets the brief and the standard of the client, because the last thing you want to do is ask someone to do something and just hand it over without checking. So quality assurance and quality control is really important. So
Well,
it's
yeah.
interesting.
When you're self-employed, it's every single project is your baby,
It's true.
and you, yeah, it's got to be right.
Yeah. So, what do you want to do more of in the future, and what would you like to talk about in terms of your projects?
What projects that I've worked on?
Oh no, projects that you've got.
Forthcoming projects.
Yeah, yeah.
Okay. So I guess I am moving towards, speaking about that process, I'm moving towards doing more at that beginning part of the process of helping people think through, um, perhaps how they're going to convey something, which elements they strategically as an organization want to communicate, and why, and how they might go about that. And so, you know, that includes doing things like insight work, working with senior leadership teams to really help them pull it out. I find that working with senior colleagues who work at that sort of strategic level, um, kind of have an incredibly, well, just a really their brains work at a different level to
Yeah.
communications people. Yeah, so they can see things in a kind of big picture way that I can't grasp in exactly the same way, but there can be a difficulty in in bringing that down to the kind of practical level. And so I'm quite I'm quite effective at being a bridge between that, whether it's for very sort of working with academics or with kind of strategic people to help them really distill the complexity of those thoughts down into very specific messages and think, okay, so what are we going to do with those, and how are we going to express them?
I love that. I love that you talk about being the bridge between, the complexity and then the actual audience, and making sure that you get the message right. And it's the in between and the building of the bridge that's so important, because if you don't build a good bridge, you're not going to get the message, or the right message, across. And it's important that that bridge has a good infrastructure. And then also, you know going back to your mention of PIF, which is the Patient Information Forum, having that content process, and it's how well you prepare in the beginning that is going to reflect in your final product. So if you take that time to work on the process, get all the insights and information that you need, that is the hardest part. And then actually producing it becomes a lot easier and less stressful, because you know that you've done everything you can to make sure that it's going to be the best thing that it is. Because there's nothing worse than starting something and then all of a sudden having a doubt and thinking, oh, but should we do it this way or that way? Which one would be better? And you start to realize that maybe you should have thought about that before you had hired the camera person or the video editor or the writer, and that kind of thing. And like you said, up to that point, it can be a bit too late, and you're kind of fixing things rather than creating something that should be having an impact that you originally wanted it to have.
Definitely, because actually, what you have to have at the foundation of any of these projects is it's about things like the values,
Yeah.
and the tone and the culture and all these things. And this is where my anthropology, has done the kind of full circle. And I've realized that I've been, a lot of the people I've been working with in things like health quality improvement also have a background in anthropology, working in things like culture change and stuff. So, and I think those kind of qualitative research skills that I developed then, and also kind of thinking about different ways that people communicate and different sort of cultural language in a way that different
Yeah.
audiences have. um it does that needs to be sort of made explicit, so exactly why are you approaching something in a certain way, as opposed to just, oh, let's do this thing.
Yeah. And it helps them feel seen as well, because they're more likely to connect with what you've created, and then capture that message and then internalize it and actually think about it and then take action, whether that's seeing the doctor or going for a scan or something like that. And I think, like you said, there are different levels of culture, and then there's also different levels of accessibility in terms of health literacy and digital literacy and numerical literacy. And then you want to try and be as inclusive as possible at all times and consider diversity, because we are not a homogenous culture. We are beautifully diverse, and you need to consider that in your communications strategy. So that's I think, I agree with everything that you've said, and I hope everyone in the audience will see that the amount of research and preparation that goes into health communications materials is immense, and it needs to be. It's necessary, and it's better if you develop that very early on in your career. And I think the King's Fund was a great foundation, because the reports and the insights that they produce are always referenced, because they're so helpful and they're so insightful. And I was lucky enough to meet the team. I think they were at HET, which is the digital health event. I think a couple of months ago, and they're so lovely and so nice. And they said, yeah, go on the website. You can access all this research and all these insights. And it's just really interesting to know that there's that think tank that is producing this information. And unless you know about it, you probably wouldn't go or think to look there.
Well, I think, yeah, when you think about health, or medical, it's really easy to focus on information for service users. But a lot of what I work on is for people working in health policy, perhaps people working in government, but also staff, health staff. I mean,
Mm.
there's more than 1 million employees of the NHS. I've done a lot for NHS England, and those people are just as diverse as everybody else. And so in a way, whatever kind of pot your audience fits into, there's going to be a whole range of needs, just depending on all sorts of things. And it's just trying to understand, what is what is the purpose of what you're doing, and
Yeah.
how can you make sure that it meets the needs and preferences of whoever it is you're trying to talk to.
Amazing. So thank you so much for sharing everything that you shared with us today. And I will leave a link to articulate.health, which is the health communications consultancy that Eleanor runs. And I'll also leave a link to Eleanor's LinkedIn so you can connect with her. And if you are in the UK, then have a coffee with Eleanor as well if you can. And I look forward to meeting you in person soon, Eleanor. Hopefully around Christmas time, if
Yeah, that'll
possible.
be lovely.
And yeah, I hope you enjoyed this episode, and we will see you at the next one. Bye.
Bye. Thank you.